back class, we're going to dive into, and again, there are certain groups of actors, as we talked about in the healthcare environment. There are the consumers, employer groups, employees, patients, that that group that um, seeks healthcare goods and services. You've got health plans, who are the facilitators between the providers and those consumers that are seeking services. You've got the healthcare providers that are producing the healthcare goods and services. Then you've got the policymakers sitting over here, kind of on the fringe or on the outside. And so, with this section, we're going to talk about just consumer decisions. So, when we talk about consumer decisions, and when it, when you read journal articles, especially, or when you read articles in uh, magazines, newspapers, you hear the talking heads, either at Fox or CNN or I don't know, MSNBC or whoever you listen to, they are focusing on waste and abuse, and they're mostly focusing on either the health plan or the payers. The policymakers and the government agencies are, for the most part, they're going to be focused on the providers. And I think sometimes on the consumer side of the house, they kind of lose track of the the significant impact that the asymmetric information that consumers may tend to provide, and it really skews and really impacts, not only skews the accuracy of the claims adjudication process, but it negatively impacts that healthcare trend. And when we talk about healthcare costs in general on the consumer side, we're mostly talking about employer groups. We're mostly talking about government type health plans, TRICARE, VA, Medicare, Medicaid. But healthcare costs are one of the huge drivers of employer groups when it comes to looking at their total cost. Again, you got fixed cost and variable cost, and it's going to fall in that variable cost category. So healthcare costs drive employer groups, and it's the real wealth or the disposable income, which we've talked about, that drive consumers' decisions. So I think I alluded to the fact in one of the earlier modules. It is up to the health plan that is selling the benefit plans or the contracts to the employer groups to vet the information that the employer group provides them. They go in, they do their sales pitch, they negotiate the rate with the premium, which is a negotiated rate with the employer group. They negotiate that rate, and then the employer group gives them a list of employees that should be covered. And the incentive for most health plans, especially on the sales team, is to grow the number of contracts that they sell, or more importantly, the number of covered lives. And so at that point, it may not be, since that's the financial incentive of the sales team within the health plan, it may not be beneficial for that sales team to vet these individuals that the employer group provides them. And I've been involved in more than one case where the employer group is inflating the number of employees that they have in order to provide cost-effective health care to friends and neighbors and family. And it and the rationale goes back to the real wealth and the disposable income of individuals who may not be employed with that employer group. And when they look at the cost of securing health care as or a benefit plan with a health plan on an individual basis, it's so much more cost effective to go if you can secure it through the employer group. So it's up to the sales team to vet that information. And one way you vet it is there are quarterly reports in most states that the employer group has to submit to the state that verifies here are the number of individuals I have working for me in my health plan that can use the benefit that we provide. So they may be based on number of hours. Some health, some employer groups you have to work 32 hours to get full benefits. Some you have to work 25, others 30. It depends on the employer group. But at that point, it's up to the sales team within the health plan to vet this information. And the more that an individual's disposable income is negatively impacted, especially with inflation, the higher the probability that those individuals will try to link up with an employer group that they can show that and purchase their health insurance through that. So again, it's not uncommon, but it may not be run of the mill happening, but my guess is that most health plans, because they don't vet that type of information, there's probably some of that falling through the cracks. Another thing that happens during the enrollment period is the asymmetric and inaccurate information that both employers, through their list of employees that they give to health plan, and employees provide during the enrollment period. They fail to mention for whatever reason, and then some of it can be innocuous. I mean, just they just don't think about it. But are they covered by some type of other insurance plan? And we have it a lot where the employer works for one company, or the employee, and let's say it's John Smith works for one company and Mrs. Smith works for another company, and they don't stop to think about who's going to provide the coverage. And they may have selected a individual and spouse, or an individual and family. Either John Smith or Mrs. Smith may have chosen both of those with the companies they work for, but they don't. When it comes to filling out information during the enrollment period, they don't stop to think about it, or they stop to think about it and they purposely don't provide that information. So you've got information on coordination of benefits. You've got information on workers' comp that's not ordinarily provided. You've got you've got information, asymmetric information that falls under some kind of motor vehicle accident. It may be a subrogation, maybe a fall at Walmart, and they're suing Walmart. So, and individuals, as they work this through, either with their lawyer that's working the case, or they're just trying to work it through themselves, in their mind, they think that if they disclose that information, it's going to negatively impact the dollars or the benefits that they may be entitled to through, again, workers' comp, maybe motor vehicle accidents where there's some legalities going on with the insurance companies, or especially subrogation. So that type of information is being withheld not only during the open enrollment period, but it's also being withheld when they go in and talk to the doctor's office. If they're admitted to the hospital, it may be withheld. And as it's withheld, you see, once you get into the CMS 1500, which is the medical insurance form, or the UB04, which is the hospital form, you'll see that there are opportunities for patients or members to disclose this information as you go down through the form. And a lot of this information in the open enrollment period, or when they're providing information to the healthcare provider, it's self-reported information. It's really difficult for the provider to go back and verify that. And when it comes to verifying things like coordination of benefits, subrogation, workers' comp, motor vehicle accidents, that's when it falls to the health plan to take care of that. And that's when it falls to the health plan, where it's turned over, typically under a payment integrity shock, to track that down on the individual consumers. We also have issues with individual consumers, and talked about it earlier, where we talk about moral hazard. Again, something you typically see in the property and casualty world or the P&C world. But it falls under when you as a consumer, when you go out and you say, well, I'm paying a premium through my employer and I get this benefit plan and I'm going to maximize the benefits I get from this benefit plan. If I've got a low financial burden when it comes to copay, let's say $5, I may go to the doctor a lot. If it's a zero copay, I may go to the doctor a whole lot. If it's minimal financial risk when it comes to pharmaceuticals, you're going to grab those pharmaceuticals every time you have that opportunity. And we find members or consumers stockpiling pharmaceuticals, or they're actually taking it. As I said, I've witnessed it multiple times downtown Buffalo. They're going out, they pick it up at my location, it was a Rite Aid. They pick it up at Rite Aid, and I saw them walk out and sell it on the street to whoever's willing to pay. And it was almost like this barter economy. They were swapping their medications for cigarettes and alcohol, and some of them were swapping it for cash. So a barter economy, and it was a open market just right outside the front door of the Rite Aid pharmacy. You also have addiction and doctor swapping on the consumer side. We've over the years have identified, and you can use it with. There's some programs out there with that work off GPS coordinates, and you're tracking these individuals, and they may be going into a half a dozen different emergency rooms, urgent care clinics, and during a week's time, and getting prescriptions, and then taking the prescriptions and going to multiple different, pharmacies, going to Sam's Club, going to Walmart, going to Costco. They're downtown at CVS or at Rite Aid, and then down to Walgreens, and it's doctor shopping, and they're traveling around the local area collecting these pharmaceuticals. And especially if it's a pain medication or behavioral health medication, they may be addicted to that pharmaceutical, or they're just doing it because they know that they can sell it and make additional money by selling it on the black market. And the last thing they do is they tend to, based on their behavioral patterns, they tend to shop the potential benefit plans, especially based on the financial liability assigned to those benefit plans when they go to it's typically called the benefits administrator at the employer group when they go to select their benefit plan when they're going through the open enrollment process. Issues that we also see on the consumer decision, and I mentioned most of them, you've got subrogation, you've got coordination of benefits, you've got motor vehicle accidents, MVAs, you've got workers' comp, you've got Medicare and Medicaid, you've got TRICARE, you've got VA. And when it comes to members trying to, they're selecting that middle pillar, with the three pillars, it's just like opportunity, cost, self-interest. And then now they're talking about self-interest. They're trying to optimize the benefits that they receive through the benefit plan that they have been allowed to purchase through their employer group. And it's been taken out of their paycheck every couple of weeks. And they're going to optimize everything they can out of that benefit plan. You have, I think when you hit 65, you're automatically eligible for Part A on Medicare, and that's the hospital part. If you're still working, you don't have to pick up Part B, which is the physician part of it. But once you hit 65, and even though let's say you're working at Starbucks, you're a full-time employee. And Starbucks, they're having to hire, or McDonald's especially. You're working at McDonald's, you're a full-time employee, and they're hiring a lot of older citizens to work at McDonald's. And when it comes time to open enrollment on the health plan they have, and you're over 65, and it says you covered by Medicare, you have a lot of people say, no, I'm not covered by Medicare. Now, either they don't know that they're covered with Medicare, which I find it hard to believe, or B, that they don't want to get into the um, coordination of benefit aspect between, at that point, probably traditional Medicare. And so they're trying to coordinate, but the health plan is going to try to coordinate between traditional Medicare and the commercial health plan that McDonald has purchased. So that's it gets extremely dicey. And again, it goes back to Errol's article where you're talking about uncertainty, you're talking about asymmetric information, and it is a extremely negative impact when it comes to trying to mitigate that healthcare spend trend and to try to reduce that 3, 4, 5, 6% increase on an annual basis. And then at some point, and I don't remember which module it is in this sequence, but we're going to get into the life of a claim. And there's a pre-adjudication phase, there's an adjudication phase, and there's a post-adjudication phase. And as I discuss it in the module, the pre-adjudication phase, from my perspective, takes place from the time that open enrollment occurs until the time that that claim leaves the doctor's office to go to the payer. And so there is a lot of opportunity for asymmetric and inaccurate information to be provided by that member. Open enrollment, got your member ID card, you go to the doctor's office, you have a questionnaire you have to fill out. If you don't provide accurate information there, you go in to see your physician. Maybe the patient is withholding information there. There are a lot of opportunities for, again, inaccurate information and asymmetric, especially information. And now we're getting back again to that agent principal issue. And that takes place, from my perspective, in that pre-adjudication process. That's where all the information is collected. Once that claim is put together and sent to the payer, usually the health plan goes to the payer, that becomes the adjudication phase. Health plan has the claim, they start to run it through the system, it's processing, it's checks and balances and vetting information, and it spits out the dollars that is sent back to the provider. And once that dollar goes out the door to the provider, then that becomes the post-adjudication phase. And it's in that post-adjudication phase that the health plan is doing a lot of their post-payment type of activity, especially in a payment integrity world. So it's in the pre-adjudication phase where the consumer, the member, the patient, has a significant opportunity to impact the accuracy of that claims payment, and also the provider, because the provider, it's in that pre-adjudication phase that provider can kind of play around with the numbers, as I talked about earlier. If you start, upcoding, if you're a provider and you start upcoding on office visits, that all takes place in that pre-adjudication phase. And with that, we're going to stop for a few minutes. And when I come back, we're going to talk about healthcare ethics and the strategies from the payer's perspective. Talk to everybody in a few minutes.